During the pandemic, we've been discussing what the medical options are right now for people who may have non-coronavirus health conditions and the best approach for maintaining their health and receiving care. Joining us today from Hartford HealthCare studios to talk about vascular conditions is Dr. Ali Irshad, a vascular surgeon with Hartford HealthCare. Thank you for being with us, doctor.
Thank you for having me.
So how do you ensure good vascular health and avoid blood clots while all this sheltering in place is going on, since we're not moving as much?
That's exactly right. Because of the shelter in place and some of the decreased social interactions people are having, many people are not moving around as much, and it's causing them to have less ambulation or less walking, less exercise. The best thing you can really do is just walk. The American Heart Association says that you should have at least 30 minutes of exercise at least 5 days out of the week. This can include anything from lifting weights, brisk walking, jogging, running, even climbing the steps in your home.
And we're going to show some of that activity with our next guest from Hartford HealthCare in a few minutes. What type of medication is especially important for people to make sure that they are taking during this pandemic?
That's a good question. It depends on what sort of vascular disease you have. Now, many patients who have vascular disease, they have what's called atherosclerotic disease, which is plaque buildup in their vessels. This can be anywhere from their vessels going to the brain in their neck, which are called the carotids. It can be, which if plaque builds up there, they can have a risk of stroke. It can be in your coronary arteries, which is in the heart. It can even be in the vessels that supply blood to your legs. And the way to minimize the effects and obviate the effects of atherosclerosis is to take an aspirin, 81 milligrams, which is a baby aspirin, can be bought over the counter. Also taking cholesterol-modifying medications like statins, which can be, you can speak in greater detail with your own doctor, your primary care doctor, your vascular surgeon. And then patients who have known peripheral arterial disease, especially in their neck vessels, in the carotids, they should be on something called Plavix, which is also a antiplatelet therapy, which is basically like an aspirin but a bit stronger. And of course, lastly, it's very important to keep up with your blood pressure medications and keep good blood pressure control.
All right, and doctor, we understand that you had coronavirus. Tell us about your symptoms. How are you doing? What did you go through?
So I have to specify and clarify, I had it. I no longer have it. I have been tested negative now. After going through several tests, I am negative now. I had it last month, essentially. Since then, I've been completely fine. I've recovered, thankfully, completely. I'm back at work. But yeah, during the time that I had it, it was pretty difficult. I had all the symptoms of myalgias, arthralgias, shortness of breath, headaches, the many symptoms that are described in public today. However, over time, I was able to overcome them, and now I'm back at work.
Well, you are an inspiration as a survivor, and you're right back there on the front lines. So we thank you for sharing your story, too. Dr. Ali Irshad, vascular surgeon with Hartford HealthCare, thanks for being with us today and also sharing your story.
Thank you.
Thank you.